First of all, there's something called pH. And you guys need to know that pH stands for power or potential, depending on what book you read, of something called hydrogen. Okay. Now, hydrogen is an ion. Okay. It's a very tiny microscopic element that produces some discharge of energy. But in the context of ABGs, arterial blood gases, and pH and all this stuff, hydrogen, I want you guys to know that it represents acidity or it represents acid. So from now on, when you think about hydrogen, the H in pH, it represents acid. And so when we talk about our pH, our blood's pH is supposed to be in a particular range, meaning we're supposed to have a certain amount of hydrogen in our bloodstream in order for our body to conduct its business how it's supposed to. You guys have to know that there is a broad spectrum of the range of what pH can be. It can be as high as 14, as low as 1, and the midpoint or the neutral is 7. Now, that's for the whole spectrum. We have different fluids. We have milk, we have water, we have lime juice, we have juices, we have Coca-Cola, we have all these different fluids. And all of those fluids, they run the spectrum of the pH. Some of them are, the pH is really high, some of them the pH is really low. And the first thing I want you guys to know, aside from what hydrogen means, that pH, hydrogen means acid, right? But the lower the pH is, we call that acidosis, meaning that when the pH is low, it is in a condition of being very acidic. But notice how I'm saying very acidic or highly acidic, but that doesn't mean the pH goes up. In the spectrum or in the range of the pH, when you have a lot of acid, the pH goes down. And that's the tricky part. You have to be able to take okay, a lot of acid pushes this pH down. Okay. So anything below 7 is considered acidosis. 1 is extremely acidic. For instance, like your stomach acids, the substance that you find inside your stomach, those acids, the pH value of that should be less than 4. And the more acidic it is, of course, it breaks stuff down. But then you have the opposite of that. When the pH is high, that condition is called alkalosis. Okay? That means you have less acid. That's the first part I want you guys to understand. When it comes to the spectrum of pH, the higher the pH is, when it's above 7, we call that alkaline alkalosis. We also call it base. I will be referring to this alkaline or alkalosis as base. And then the lower it is, we call it acidosis. Okay? All right, that part's there. Now, when it comes to this whole pH thing, right? Your body's pH is like your body's temperature, although it has nothing to do with temperature, but hear me out. A person's average temperature is about 98.6 degrees, right? That means that if your temperature is about 98.6, you know that your body is in what we call homeostasis. It's in equilibrium. Everything is cool, everything is copacetic, and your cells can function just fine, right? It's not too hot, not too cold. But if your temperature is at 105 degrees, can your cells anywhere in your body function well? They can't. They're going to get fried like eggs. And then if your temperature is too low, if your temperature is 93 degrees, even though that's still considered warm, but for our body to function well, 93 degrees is too cold. It won't be able to function. So in a way, that's kind of how your pH is. Your pH has to be in this therapeutic range. Your blood's pH has to be between 7.35 and 7.45 in order for your body to function just fine. Just like your body's temperature has to be about 98.6 degrees, give or take a degree, in order for your cells to function just fine. And continuing to use this temperature thing as an example, as an analogy, if you get too hot, if your temperature goes up to 103, 104, 105, what does your body do? Does it just take it and die? No, your body has defense or compensatory mechanisms. And when your temperature gets too high, What does your body do to cool down? It sweats, and that's how it cools down. That's a compensatory mechanism. Your body is equipped with a means to maintain that the temperature within its therapeutic range of 98.6, give or take a degree. And then when your temperature gets too cold, let's say it gets down to 93, 94, what does your body do? Does it just stay there and freeze? No, you're not going to freeze with 96. I'm sorry, with 94, 93, but you can actually die. Your body's metabolism isn't warm enough to function. So what does your body do when the temperature drops? It shivers. Your muscles contract really fast and your temperature goes up. Your body has a mechanism of regulating temperature, and it's for the purpose of maintaining homeostasis. Well, your body also has mechanisms to maintain a normal pH, a normal power potential of hydrogen. Okay? Let me continue real quick. So these mechanisms that I'm describing right now, now let's talk about just pH, okay? pH. I was using the temperature thing as an analogy of how that functions. Your pH functions similarly. Your blood's pH should be between 7.35 and 7.45. And then what I was just discussing a little while ago, when it comes to the spectrum of pH, your blood's pH is technically slightly what? It's slightly alkaline. It's slightly basic. That means Dr. Sebi, for those of you that know Dr. Sebi was right. He said that if in order for a body to function properly, they have to be in a more alkaline than acidic environment. So technically, Dr. Sebi was correct. Anyways, so your blood's pH should be 7.35 to 7.45. Your stomach's pH is not 7.35 to 7.45. Your stomach's pH is 4.0 or less. So every pH that we're describing right now has its purpose. So your blood's pH must be between 7.35 and 7.45 for your body to function just right. Anytime your pH goes above 7.45, in this context, we call that alkalosis. Anytime it goes below 7.35, we call that acidosis, because it technically, even though it's not below 7, but in the context of what our blood should be, anything less than 7.35, we consider that acidosis, okay? Now, your body is equipped with mechanisms that maintain pH as well. The first mechanism is known as the buffer system. And the buffer system is literally just molecules. Now, the book, I'm not going to talk about it in the way that the book discusses it, simply because it becomes a little bit more about chemistry, and then I'm going to lose half of you guys, okay? But I do want you guys to understand this. There's something called carbonic acid, and there's something called sodium bicarbonate. Now, those are the elements that represent either acid or base, respectively. But what I want you guys to know is the following. The buffer system, for the sake of explanation, is composed of two molecules, either carbon dioxide or bicarbonate, HCO3, okay? By the way, CO2 is that carbonic acid, and then when it mixes with water, it diffuses. And see, this is why I'm not explaining all these things, because it's a little confusing. But this is what I need you guys to know, that the first system that your body has to maintain that pH 7.35 to 7.45 is called the buffer system. The buffer system. And that includes molecules of carbon dioxide and bicarbonate, petroleum, swimming throughout your bloodstream. And whenever the pH goes too high or too low, your CO2 and HCO3 go there and buff it out and keep it normal. To be more specific, both of these HCO3 and CO2, what they're regulating is hydrogen. Now remember, what did I say at the beginning of all this? Hydrogen equals what? It equals acid, right? Hydrogen equals acid. So your buffer system, which includes carbon dioxide and bicarbonate, what it does is this. Whenever you have CO2, the more CO2 you have, well, what this does, it directly influences hydrogen. What it does is CO2 increases the hydrogen concentration in the bloodstream. And since hydrogen represents acid, the more CO2 you have, the more acid you have. You don't have to worry about memorizing CO2 increases hydrogen ion concentration. No, you don't have to know that. Just know CO2 represents acid. Okay? And so HCO3 does the opposite. HCO3 decreases hydrogen concentration in the bloodstream. It removes it from the bloodstream. And because the less acid you have, that will lead to now there being a more abundance of the opposite of acid, which is already there, which we call alkaline. So because of that, HCO3 removes acid from the blood, removes hydrogen, which equals acid from the blood. So if we have less acid, we have more base or alkaline. Same thing. I hope that makes sense. So again, the first system that we have that is controlling our pH, our potential hydrogen or our power of hydrogen, is these molecules of carbon dioxide and HCO3. Now you right here in this illustration right here, or this little segment, you understand why this happens. You don't have to know the why for this particular one. It's nice to have in the back of your mind. Yeah, CO2 increases hydrogen, acid, so CO2 equals acid. So whenever your blood, it's not acidic enough, then your body will send its CO2 to buff the blood to create more hydrogen, and now your blood's more acidic. Okay, whenever your blood doesn't, whenever your blood has too much acid, HCO3 will come into play, meaning you have too much hydrogen, right? Too much acid. HCO3 will come into play, and it'll buff the blood and remove hydrogen from the blood, and then therefore making it more alkaline or basic. I hope that makes sense. Okay. But you don't have to know all that stuff. All you have to remember is that CO2 equals acid and HCO3 equals base. And that's our buffer system. What happens is that CO2 and HCO3 are constantly, continuously patrolling your bloodstream. And whenever this pH goes out of whack, whichever one has to do its thing, like I just explained, it'll buff it and keep it in its therapeutic value. I hope that makes sense. Now, when that fails, though, okay, when that fails, you have a second system that comes into play to maintain pH balance. That is your lungs. But see, your lungs are pretty effective because they can do stuff right now. We can increase our respiratory rate or we can slow it down. And which gas are we either eliminating or keeping? And by the way, it's not oxygen, okay? Oxygen is to help our cells function, but in a different context. Right now, I'm talking about maintaining pH in the blood. And since CO2 and HCO3 are directly responsible for that, your lungs are directly influencing carbon dioxide. And a little while ago, what did I say? Carbon dioxide technically equals acid, right? I'm not going to go into the explanation of how it influences hydrogen because I explained that already. But lungs can control CO2, which technically is acid. So your lungs can either increase its respiratory rate and we get rid of acid. And if we lose acid, our body now has more base, and that can lead to alkalosis. Okay, again, if we increase our respiratory effort, our body gets rid of CO2, which is acid. We're losing the acid. That means that's what's left is the base, alkaline, and that will increase the pH. Okay, because we lose the acid, our body has more alkaline now. Remember, we lost the CO2, acid. Our body is left now with more base, more alkaline. Now, how does that translate to the pH? Oh, what did we say? Alkaline is pH goes up. Okay. But what if our lungs slow down its breathing? Okay. If we slow down our breathing or we stop breathing, we're not getting rid of CO2. That means we're keeping it. And by the way, your body is constantly producing CO2. Every time your cells receive oxygen, it gives away its waste, which is carbon dioxide. And that's all we have to breathe. 12 to 20 breaths per minute gets rid of enough CO2 to maintain homeostasis. But if we slow down our breathing, are we getting rid of CO2? No. That means we're not getting rid of CO2. We're not getting rid of acid. That means we're keeping CO2, which means we're keeping acid. And that means our body becomes more acidic, and that translates onto the pH spectrum as a low pH in acidosis. I hope that makes sense. Now back to this more specifically. We talked about the buffer system. Now we just explained how the lungs can also influence pH by either keeping or getting rid of CO2, which is also acid. By the way, any patient that has impaired gas exchange, like COPD, tuberculosis, pneumonia. I don't care. They can't get rid of their CO2, so they're going to have acidosis. Okay. And because their lungs are responsible for this abnormality, we call that respiratory acidosis. But I'll explain that in more detail in just a bit. So we have the buffer system. We talked about the molecules buffering the blood so it can maintain pH. And then we talked about the lungs. The lungs can influence your respiratory rate, which can either increase its respirations by getting rid of CO2 or slowing it down by keeping CO2. And then the third mechanism that we have is your kidneys. Now, your kidneys are really unique because your kidneys not only influence the HCO3 part, they can retain HCO3, but they can also directly influence the big boss, the hydrogen that we've been discussing this whole time. That is why your kidneys are really impressive. Your kidneys can actually carry out a much more efficient control of pH than any other system. The problem is that it takes longer for it to get to where it's supposed to be. So it's slower. Excuse me. So I want you guys to know that the kidneys, through your urine, whatever's happening in your bloodstream, right, when it comes to hydrogen, your kidneys can either keep HCO3 or get rid of hydrogen by itself, meaning that your kidneys are much more efficient because we just discussed earlier that CO2 and HCO3, their whole deal is that they're trying to fluctuate hydrogen, right? So when we talk about CO2, it's like indirectly influencing hydrogen, but your kidneys can directly influence hydrogen and HCO3, the thing that controls hydrogen. I hope that makes sense. My point is that kidneys are much more comprehensive. They're much more thorough in regulating pH because they can control HCO3, which directly influences hydrogen. And we know that HCO3 represents base, right? Base, alkaline. But your kidneys can also get rid of hydrogen, which is directly the acid part that we're trying to get rid of here or keep. That's why the kidneys are much more efficient. So you guys have to know that these are the three mechanisms that your body has to control pH. Now, why is this important? Well, because you guys got to know about arterial blood gases, ABGs. Now, you just have to know how to recognize them and whatnot. And I'll discuss that right now. But before I do that, I want you guys to know the following. You have to know that when you do an arterial blood gas, they put a needle to your radial artery and they take out a sample of fresh oxygenated blood. And the RT usually does this. But before you do an ABG, you have to perform something called an Allen's test. And I do want you guys to know this. An Allen's test. An Allen's test is a test that assesses for perfusion. So hear me out. You get the patient's hand and you put pressure with both your hands like that on their radial and ulnar arteries. And you have them squeeze their hand first. Blood goes away. You put pressure right here, a lot of pressure. And then you have them open their hand. The hand should be pale. But then you let go of the ulnar artery. When you let go of the ulnar artery, the whole hand should turn pink. Okay. And if it does that, that means that the ulnar artery can compensate in case we mess up when we go in with the needle and destroy the radial artery. So again, the Allen's test is a perfusion assessment that assesses the ulnar perfusion to make sure that since we're going in here with the needle, the radial artery, we have to make sure that the ulnar artery can make up for the fact that if we destroy this one and it can still perfuse the entire hand. That is the Allen's test. Okay, folks? And then you would let go of the radial one and the whole thing should also turn pink. That is an Allen's test. That's the first thing you do. When the respiratory therapist gets their blood sample and sends it to the lab, we're going to come back with a couple of blood related readings. So you'll have first your pH. Your pH should be 7.35, to 7.45. Now that's your blood's pH. That's what the range should be. Then you'll also see CO2. You might see PCO2. That P, ignore it. It's still CO2. It's a laboratory annotation. Okay, it's just what they do for the partial atmospheric or the partial per whatever. That's what the P stands for. Don't freak out about that. But the CO2 value you should know. You just bring down the 35 and the 45. It should be between 35 and 45. And you'll also see a O2 or PaO2, partial atmospheric O2. That should be 80 to 100. You may also see an SpO2. That should be 90 to 100. And then I think that's it. Yeah, those are, oh, and then you'll see, of course, the HCO3, which should be 22 to 26, the best years of our lives, okay? Listen, when you guys do an ABG, the lab might show you all of these. Don't freak out. Remember, first of all, the PA, partial atmospheric, partial, that's just a laboratory annotation. It doesn't change what it is. It's still CO2, it's still O2, right? SpO2 is the saturation, 90 to 100. Okay. Don't freak out when you see all of these because you're only focused on three: the pH, the CO2, and the HCO3. So let me turn the page now. So when you do an ABG, now we're going to do interpretation of ABGs, okay? When we do ABGs, you will get some lab values, and then you have to interpret them. I'm only going to put the three that we need for the sake of saving time. So let's pretend that your pH, and by the way, you should know the values now. You should memorize those. Normal pH is 7.35 to 7.45. Normal CO2 is 35 to 45, and normal HCO3 is 22 to 26. The pH, let's pretend that the pH is 7.31. Let's say that the CO2 is 51, and the HCO3 is 24, okay? Now, some of you guys probably look at this and you know what it is already. Good for you, but let me just explain. Whenever you do an ABG, I want you to try to analyze them in this fashion. The first thing that you want to ask yourself is, what is the pH? Is it acidic or is it basic? Now, that 7.31 falls below the 7.35 minimum, and anything lower than 7.35, we agreed already that it's acidosis. So we know this is acidosis. Okay. The second thing we look at is which one matches that. Now, let me explain what this means. Which one matches it? We said that acidosis is represented by CO2. We said that alkalosis or alkaline is represented by HCO3, right? So when you're doing an ABG, number one is it's acidosis. We've determined that already. Which one of these matches that? In other words, which one, if in large or small volumes, would represent either acid or base? But in this case, which one represents acid and matches that? If we have too much of this, then of course we would have too much acid and it would lower the pH to make it acidosis. So for me, I look at both of these. We know that CO2 is the one that represents acid, right? CO2 represents acid. We talked about that earlier because of the whole increasing of hydrogen. Again, just to touch on it, but CO2 represents acid. And right now, do we have what? A lot or a little bit of CO2? We have more than what we're supposed to have, right? That matches the acidic pH. So we know that the CO2 is controlled by your lungs. So therefore, this is respiratory acidosis. The HCO3 is well within its normal therapeutic level of between 22 and 26. So we know that there is no compensation, which brings me to my third point. The third thing you would want to check, is there any compensation? Oops. And what do I mean by that? What do I mean by compensation? Hear me out. Let's say my left hand right here represents CO2. My right hand right here represents HCO3. Now, when they're all in their normal levels, 35 to 45 for CO2 and 22 to 26 for HCO3, these two normal levels maintain a normal pH of 7.35 to 7.45, anywhere between them, right? However, in this question, the CO2 is high. There's more than what they're supposed to be. And we know that CO2 represents acid. The HCO3, even though it's normal, it's still not as much in proportions to what the CO2 is because CO2 has too much. Remember, even though the numbers are different, the CO2 being its therapeutic value and the HCO3 being its therapeutic value, that maintains homeostasis, which means that it'll keep a normal pH between 7.35 and 7.45. But right now, the CO2 is high, 51. And even though the HCO3 is within its normal value, in comparison, there's too much CO2. There's too much acid. And that creates a problem of acidosis. And that lowers the pH. The pH goes down. So make sure you guys know that also. So again, there's no compensation because the HCO3 is within its normal range. Sometimes in this same scenario, there's too much acid, and even though we have normal HCO3, it makes the condition acidosis, right? Sometimes the kidneys, the HCO3 will be like, there's too much of that. I gotta also increase and put in some work to level it out. That's called compensation. I'll show you guys what that looks like in just a bit. All right, next one. Let's say that our ABG is 7.51. Our pH, excuse me, is 7.51. Our CO2 is 38, and our HCO3 is 32. Now, what do? I know some of you guys can look at this, and if you know it, good for you. But let's do it like this. The first thing we do is we want to find out what the pH is. And we know that the pH is 7.51. That's above the normal range. We know that is alkalosis. The second thing we do is we look at which one matches it. Okay. Now, CO2 is within its normal range, and HCO3 is high. And we know that HCO3 represents base or alkaline, and it's made the pH alkaline, alkalosis, so we know that's what matches it. And the HCO3 is controlled by your kidneys, which is technically your metabolism. So this is considered metabolic alkalosis. The pH is high. And when it comes to compensation, did the CO2 try to do anything to fix the issue? No, because it's in its therapeutic range. So this is no compensation is seen in this one either. So this is metabolic alkalosis. Okay, I hope that made sense. Let's do another one. This one's a little bit trickier. Okay, let's say that in your ABG, let's say that the pH is 7.32. The CO2 is 39, and the HCO3 is 19. Okay, this one's a little bit trickier. Some of you guys can see this and do it. Good for you. But what do we do first? What's the pH? Well, we know 7.32 is less than 7.35, so that's acidosis. Okay, then which one of these matches? This is where it gets a little tricky. Now, right now, with the pH is 7.32, it's acidosis. What we're expecting to see is a high CO2 because that would also mean high acid. But right now it's normal. So, what's causing this acidic condition? We look at the HCO3. The HCO3 is supposed to be 22 to 26, the best years of our lives. But right now we don't even have enough. So hear me out. Okay? This is my CO2. This is my HCO3. Right now, my CO2 is normal. It's where it's supposed to be. But my HCO3, instead of it being between 22 and 26, it's not even its bare minimum. So it's 19 right now. So because even though we have a therapeutic number of the normal amount of acid, the normal amount of CO2, which will maintain homeostasis, the problem is that our HCO3, which is supposed to be between 22 and 26 to keep everything balanced, right now it's not even enough. So therefore, there's too much acid, even though it's in its normal range compared to the HCO3, which is it's not doing its job right now. There's too much acid. So because that's what's causing the issue, the HCO3, we call this metabolic acidosis. The metabolism, the kidneys, are the ones that are responsible for this abnormality. And then when it comes to compensation, there is no compensation because nothing's trying to fix it. I hope that makes sense. These ones are a little bit more tricky. We'll do one more, or at least one more example of the type that I want you guys to know. Let's say that the ABG is 7, pH is 7.32. For 8, the CO2 is 49, and the 8 CO3 is 30. Okay. Again, those of you that can see this, that's great. But the first thing we do is what? We look at the pH. What is the pH? We know that 7.35 to 7.45 is normal. Right now, the 7.48, we know that's alkalosis. Okay. The second thing is, which one matches it? Which one, if high or low, is responsible for the pH being high? Well, definitely right now, the HCO3, it being more than what it's supposed to, and HCO3 representing base alkaline, and the pH is base alkaline. So we know for a fact that it's metabolic alkalosis, but something different is being experienced here. Your CO2 is also out of whack. It's more than what it's supposed to be. It's supposed to be 35 to 45. Right now, it's 49. Why is that happening? Well, that's where this whole compensation thing comes into place. Remember, CO2, HCO3 is supposed to be normal. Right now, they're supposed to be normal. Right now, our HCO3 is higher than what it's supposed to be. There's something wrong with it, and it caused the pH to go up. So that's why it's called metabolic alkalosis. But the CO2 notices that, hey, we have too much base, we have too much alkaline. So what it does is it tries to increase also to try to fix the issue. And that's why the CO2 is also elevated. But we know that it's HCO3 that matches with the pH being high. So we know it's metabolic alkalosis. So this is known as a compensatory mechanism. The body's trying to fix it. But did it fix it? Did the pH go back to normal? No, it's still out of whack. So this is called partially, because it hasn't fixed it all the way, or partially compensated metabolic alkalosis. That's the compensation part. For those of you that are wondering, well, how do we know it's fully compensated? When these two are out of whack, and this right here is normal between the 7.35 and 7.45. That is how we know that it's fully compensated. And there is a math way to figure out which one is actually responsible for it, but there's no need for you guys to know about this, so I'm not even going to go into it. If you guys do want to know, ask me on Sunday next week at 8 a.m. I'll be there, and I'll go ahead and explain it to you guys.